Okay, so guys, welcome to the workshop. This workshop is on the science of spinal correction. Of course, this is a collaboration because after 10 years in practice, I started off doing whatever chiropractor out there does. Doing what we were taught in school, which is basically adjust it where it hurts. And we really didn't go into spinal correction. In fact, when I went through school, I don't know if it really even existed yet. The things that we're doing today, really, they weren't being highly utilized. But even today, there's only about 3 to 5% of the chiropractic population that does corrective care. It's not a very common. It's not a very common practice. So, with that said, we're constantly pushing the boundaries. We're constantly pushing new technology and coming up with new protocols and solving problems as they're coming along. So if it ever seems like, well, this part isn't moving as quick as we want to, it's probably because we haven't run into it yet. That doesn't happen very often, but some of you guys might be in that position where we're waiting on new technologies to become available. So some of that stuff we're going to be covering tonight. So this is really bringing engineering, physics, logical science all in so that we can really start to put these in as a foundation for health for everybody, because these should be just core principles that are utilized repeatedly through the general population, not just those who end up in a chiropractic office by chance, because they're already suffering the effects of what? Of subluxation that we should be stopping at very young ages. Most of us end up in chiropractic clinics because of problems that ended up occurring because we're not dealing with those problems in advance, and we want to be nixing those from the start. Okay, so scientific history. One of the oldest medical texts in existence was written around 1700 BC. That's 3,700 years ago. This is the Edwin Smith Papyrus. Okay, and in this, it's literally a field guide for battle. So the way that they used to make these medical texts was where it was relevant, right? So you're going out on the field, and basically you have these field physicians who would go out and take care of wounded soldiers. So they needed a guide to be able to train them on who to take care of and how to take care of them and what to do. And some of the stuff was kind of weird, use urine and stuff like that. The things that they would do back in those days wasn't exactly scientific. But the interesting thing about this document is what it showed, because it described that head and spinal injuries were basically hopeless. Okay? So they understood 3,700 years ago. I don't think that really shouldn't be surprising to us, right? I don't think the earliest populations had a problem understanding that, Johnny falls off of a cliff and breaks his neck and can't move his body. You know what? We should probably take care of that thing inside there. Their neck is pretty important, right? These aren't real profound principles, but the point is that we at least have documentation that they understood it 3,700 years ago. So would you say we've had a long time to figure this stuff out? Yes. Right, that's the point. We've had a long time. So they understood the importance of the central nervous system. Okay, the next one, this one, and obviously when I say the next one, this isn't the next text that was ever written. I'm just showing you guys some of the important ones along the way. This one was well later in 1741 by the professor of medicine at the University of Paris. And this is where we coined the term that we see in modern orthopedics, okay? This is Dr. Nicholas Andrey. He recognized that children whose spines remained normal did not develop disease in the internal organs as those whose spines were deformed. Okay, so Dr. Nicholas Andrey, he was the professor of medicine at the University of Paris and senior dean of faculty of physics. Okay, this guy was not he wasn't just some other guy. This was a very well respected, very well educated man, and he laid out the foundation of how this stuff works. And so where you see, unfortunately, this led to is the field of modern orthopedics, where they started doing spinal surgeries, scoliosis surgery, the modern day fusions and stuff like that. That's where a lot of this came from, because he had, some archaic techniques of, as a tree is bent, so grows a tree. So, if the tree is deformed, let's splint it back into place, kind of like we use in orthodontics. Well, in orthodontics, it makes sense because your teeth are free-hanging structures. You can just brace them and they're going to move back into place. But we've learned over the centuries that this doesn't really apply quite as well to the spine because your spine is a very, very dynamic object, right? So we've got to have better techniques. We've got to address more factors when we're dealing with the central nerve system. But nonetheless, this is where some of that information started. In 1935, Dr. Speransky, he was an associate of the famous Dr. Pavlov. Have you guys heard of him? Dr. Pavlov's dogs, right? Okay, so he published his most famous work, A Basis for the Theory of Medicine. Basically, this manuscript described all disease of the human body as a neurological event. Okay, so this was kind of like the prerequisite to chiropractic theory, if you will. And we can't really even see chiropractic theory because theory means a theory that's not backed by science. Okay, there's plenty of science to back this up now, but what he showed in short is that even infections, even bacterial infections, are neurological events. In other words, you have to have a preceding decrease in the nerve system before a bacterial or viral infection can now move in and take hold of the body and do its thing. So everything in the body is a neurological event. And he showed pneumonia and all these different things as examples in his research. So the interesting thing with this is that even though his works were in this book, this is Red Miracle, written in 1902 by Edwin Podolsky, he talks very clearly in this book about how his works were known worldwide. Dr. Speransky's work was known worldwide. It was in universities all over the place. It was well regarded. Yet, mysteriously, you really can't find it today. You can't find the information at all. It's only a few colleges have copies of his book. I actually found one on, it was available on eBay or Amazon a couple years back, but it was about $1,500, so you can see I didn't feel it was necessary to add it to my collection at that time. That's a little bit much for a book that's falling apart. That belongs in a museum or something, but Life University in Atlanta, Chiropractic College, they do have a copy. Last time I checked, and I have a friend that has a copy as well. So, but like I said, his work is referenced in other manuscripts. We know what it says, and it's still available. Hopefully, one of these websites like Google will sometime shortly make a manuscript available, like they're doing with some of this other stuff. They're taking old books and starting to digitize them. So hopefully, it will become available. Okay. In 1976, Irvin Core. He again proved centuries of practice into modern research with this paper titled The Spinal Cord as the Organizer of Disease Processes. Okay, so what he showed is that, once again, the same techniques that the spinal cord literally, it describes all disease processes. All disease processes, they start with the spinal cord, they end with the spinal cord. It is really the organizer of what happens with all disease. Okay, so he went on to continue his research, writing many more papers on the same exact topic, just basically laying that foundation deeper and deeper and deeper. Okay, science is slowly beginning to catch up, though. As you see, research is now starting to pick up. In 2005, we showed the mechanism of spinal cord destruction in relationship to posture. This was in Spine Magazine, November 30th. Volume 30, November 1st, 2005, it showed that spinal kyphosis caused demyelination and neuronal loss in the spinal cord. So what they showed, spinal kyphosis is when you lose that normal curve in your neck. Okay, so that C-shaped curve is absolutely critical in the cervical spine. But when you lose that curve, what happens is it begins to stretch the spinal cord in the posterior. So just like the skin on the back of my hand, as your cord begins to stretch, it shuts down cerebrospinal fluid flow through the spinal cord. It causes compression on the cord, and now your cells of your spinal cord actually begin to deteriorate. Why? Because they're not getting oxygen, they're not getting nutrients, right? So anytime you cut off oxygen and nutrients from the spinal cord or any cell in your body, they are going to begin to deteriorate and die. So this was shown in this study. This finding is monumental in its scale and scope of human disease as we see it in practice all the time, and and how many people are, even within the medical model, dealing with all kinds of random disease that all stems from the same thing. So the scale and scope of this is unreal, yet even today orthopedics rarely consider this curve in surgical practice. I mean, we see people all the time, even younger people in their 30s that come in that have had spinal surgeries done, and what do? They fuse them into the straight position. If the orthopedic profession just fused people into a normal curve, they would radically improve their results. Okay, there's even a study that was done looking at MS patients, and we know today that almost every single MS patient has a straight cervical spine. So what's it doing? It's causing a decrease of the flow of cerebrospinal fluid through the patient's spinal cord, and they have deterioration of the central nervous system. That's what MS is. Okay? Yet when they did a study and they looked at, they actually fused the patient's spines into a C-shaped curve, they had almost a unanimous resolution of symptoms. So why isn't this being practiced more, right? It's, these things are easily researched and easily proven again and again, yet you just don't see it catching up fast enough. A new study in 2012 in the Journal of Immunology investigated the reason why infection is the leading cause of death following survived spinal cord injury. So, of course, to sum that up, you notice when people suffer a severe spinal cord injury, and they're paralyzed, whatever, they notice that unanimously almost they die from infection. That's what ends up killing them. They can't keep their immune systems functional. And so simple bugs that you and me would be able to defeat, they end up getting pneumonia, and it kills them. So they wanted to look at and they see what is going on there. So their conclusion, of course, as you guys know, was that the spinal cord trauma shuts down immune system function because they work hand in hand. The immune system does not function independently of the central nervous system. In fact, they're so well intertwined that they're practically the same thing. So as you shut down the central nervous system, you shut down the immune system completely. Yet the medical establishment and insurance still, to this day, fail to consider preventive care of the spine as medically necessary. That's why your insurance doesn't cover maintenance or preventive chiropractic care. In fact, they even battle it on what they call medically necessary. You would think you have pain or you have degeneration in your spine or you have a cervical kyphosis, that would be deemed medically necessary. But that's not true according to insurance. According to insurance, it's only a loss of function. It's only a loss of functional capacity. It's only experiencing pain that is medically necessary. And even beyond that, if you're not fixed within 12 to 18 visits, regardless of circumstance, we are still supposed to refer you to a medical physician after that. Unreal, right? So we've got to get this research moving more into not the next century, into the last century. I mean, this stuff has been around for a while, long enough to be able to change things. More studies continue to find the same results accidentally. While they research random topics, the conclusions all lead the same path. The spine is the keystone to health. Over and over and over, you see the same thing, the same conclusion. They'll research something random, and they'll find the same results. And it's all medical research. Chiropractic doesn't have the money, really, has not had the money to really do the research that we need to do. Why? Because we don't have billions of dollars of pharmaceutical money to do it. We don't have the government grants that are driven by public interest through the pharmaceutical industry to create that research. So where we come out on top is they're researching something for, say, a spinal disc implant. That's going to make billions of dollars or at least millions of dollars in orthopedics. And it comes up with a result that proves what we do every single day. So they're inadvertently proving everything we do all the time. So here's just a few of them. This was in the Mayo Clinic, November of 2000. Forward head posture leads to long-term muscle strain, disc herniations, arthritis, and pinched nerves. Right? These things are obvious. To us, they're obvious at least. Kapanji and the physiology of joints. For every inch of forward head posture, it can increase the weight of the head on the spine by an additional 10 pounds. How much does the average person's head weigh? 8 to 10 pounds, right? So for every 1 inch that your head goes forward, you have doubled the weight of your head. How many people do you know that have at least 1 inch of forward head posture? Almost everybody. Because of computers and cars and sleeping on one of the worst inventions ever created, a pillow. They're comfortable. You know, it's kind of like sugar. Sugar is good for you, but it's terrible for you, right? You know, it tastes good, but it's terrible for you. Well, pillows feel good, but they absolutely destroy you. Because they create forward head posture and reductions in that curve. Dr. Alfred Brigg, neurosurgeon and Nobel Prize recipient, showed that the loss of the cervical curve stretches the spinal cord by 5 to 7 centimeters. Okay, think about this for a second. Your spinal cord only goes from here to about right here. As you know, when you're born and you're a little kid, it goes all the way down, but as you grow, it stretches up, and it's actually the bundles of nerves called the cauda equina that go down into your legs and everything else. But your cord is only about that long. So you take that and you add another 5 to 7 centimeters on top of that. That's unreal. I mean, that's that much stretch. That's a ton of stretch on that delicate spinal cord. So that, of course, as a result, causes disease. Dr. Roger Sperry, Nobel Prize recipient for brain research, showed that 90% of the stimulation and nutrition of the brain is generated by movement of the spine. So how important is it that you have a fully flexible moving spine? It's critical. So additionally, 90% of the energy output of the brain is used in relating the physical body to gravity. That's called proprioception. We know that through chiropractic adjustments, it improves proprioception. That's why your balance improves as you're getting adjusted and getting things fixed. Only 10% has to do with thinking, metabolism, and healing. So when you have forward head posture, your brain will rob energy. Think about this, if you can, right? It will rob energy from your thinking, from metabolism, and immune function to deal with the abnormal gravity-posture relationships and processing. Unreal. So if you think, you know, why am I stressed? Why do I have foggy thinking? Why am I tired all the time and everything else? Look to your posture. That's what that research is showing. Unbelievable. To live a long, active, energetic life, few things matter more than good posture. That was Rene Callier, MD. Posture affects and modulates every physiological function from breathing to hormonal production. Spinal pain, headache, mood, blood pressure, pulse, lung capacity are among the most easily influenced by posture. That was the American Journal of Pain Management. And then another study in 1981 showed that the average life expectancy of individuals with scoliosis is decreased by 14 years. 14 years. Now you figure that. What's the average life expectancy of an adult? It's about 74, 76 years old, depending on which study you look at. So that reduces it to just above 60 if you have scoliosis. That's unreal, right? So we've got to do more research in this area, but you understand it's probably not going to happen. It's not going to happen unless it's an inadvertent, because there's got to be money to provide the research. And nobody really is going to do the research unless they have what to make from it? Money. Yeah, research is an investment, right? Research is an investment. So there's got to be a vested interest in doing the research. Unfortunately, that's where things are today. Okay, Anatomy 101, critical structures to spinal anatomy. Okay, we're going to go through the basic foundations of the body so that you guys get, who in here has taken anatomy before? We've got 3 people. All right. Okay, so this is new information for most of you. Okay, so bones. The bones aren't just hard structures in your body that make you stand up, right? The most important function of a bone is it acts as a lever for movement. Okay, you think about an amoeba or a squid or something like that, you know, that the invertebrates that don't have bones, you know, they just kind of slide around and everything else, so they use deformations of their bodies in order to create movement. Well, as a human, or as a vertebrate, as a body that has bones, you know, your bones provide movement. They provide hinges. So now you look at that and you see ligaments are bone-to-bone connections. So in order to hold my radius to my humerus, okay, you've got to have ligaments in between there that hold those bones together and allow that bending. Okay. Well, now that you've got that bending, you've got to have what? You've got to have a motor to provide the movement and allow that to move and allow that to bend. So the muscle is the motor to move one structure in relationship to another. Okay, and it's not always bone to bone, but typically it's a bone to bone. The tendon is a connection of the muscle to the bone. So if you've ever heard, you've got a rip tendon or something like that, or a sprain of a tendon, that's where the muscle actually, for example here, carpal tunnel syndrome is a perfect example of this. Most people, when they go in for carpal tunnel surgery, what do? They cut them at the wrist right here to relieve the pressure off the carpal tunnel. Well, the problem is not actually in the wrist. The problem is actually the muscles up here. If I've ever worked on any of you guys that have carpal tunnel, you've been crying in tears, right? I know I did it to you. Crying in tears as I rip your arm apart, right? It feels like you're tearing that muscle to pieces because the muscle is right here and it's overworked, creating tension on the tendon that connects that muscle to the bone, right? So the tendon creates irritation down here and rubs, but the problem is the muscle is overworked up here. This is where it needs to be worked out. The tendon is kind of an inanimate object, if you will. It's just a connection point. Okay, the fascia, this is something that is not talked about enough. Who in here has even heard the word fascia before? Nobody, right? One. All right. So most of us have never even heard about fascia before. If you look here, this is fascia right here. You have it all over in your body. There are these giant sheets of, I'll tell you what, have you ever seen new homes being built and they've got that Tyvek home wrap around them? That paper wrap have you ever tried to rip that stuff? Okay, it's like impossible to rip. They make them out of the mailing bags now. That they're the soft bags. Yeah, I mean, they're nearly impossible to rip. Unbelievably strong. Well, that's the way fascia is. Fascia has an incredible strength to it. And what it does is it wraps muscles, it sits in between muscles, and it holds muscles together. You have it throughout your entire body. It provides wraps over, over here in your ankle. It provides the flexion around tendons so that they can move and you can flex and everything. Otherwise, you'd have a weird muscle that goes down here to the top of your foot. Your foot would look like a boot, right? That's what fascia does in your body. It provides protective sheaths, but it also allows movement, like a tendon allows movement. It actually, as muscles contract here, it pulls on the fascia, and what does it do? It pulls and moves your entire spine with it too. So you can't talk about movement in the body without talking about fascia and the effects there as well. This is really important when you're talking about spinal correction. And then, of course, the most important component, the nerve system. The nerve system is the power that runs the entire system. Okay? A computer does not work unless you plug it into what? An outlet.
Right.
And you have electricity that runs that. Well, a body is a body is a body, right? If I'm standing right here, I'm moving around, I'm doing everything, I'm just a body. Well, I'm also just a body if I died 5 seconds ago and I'm laying on the ground, right? All the stuff is there. The bones are there, the muscles are there, the ligaments are there. What's missing? The power. And without the power, nothing works. Okay, so you can't talk about the whole system without talking about the nerve system. So no tissue left behind. We've got to look at how these different things work together. We got to look at how bones work with bones, ligaments work with bones, muscles and the tendons are attached to work with the bones, the fascia to the bones, the ligament to the muscles, the fascia to the ligaments, the fascia effect on muscles, right? You've got to look at all these interactions if you're going to figure out how to correct a spine. It's not an easy process, right? You see the possibilities here are endless, not even mentioning that there's actually 24 movable bones in the spine. So when you look at how that actually calculates out, you figure out real quickly it's in the millions of combinations and possible scenarios that happen in the human spine. It's unreal. It's almost unimaginable. Now you can start to see why. Who do we rely on most to fix you? Your brain, your spinal cord. Most of it is just giving the nudges to defer the healing power so that your brain can start to figure out what to do to actually fix you. Because there's just too many combinations to really figure it all out ourselves. But there are some additional considerations that you have to go into before starting to correct a problem. You've got to know that there's proper blood supply to the tissues, right? If you don't have proper blood supply, things aren't going to work right. You're not going to heal right. You've got to make sure that nutritional deficiencies are fulfilled, that you don't have nutritional deficiencies. You've got to make sure that there's no interference of medications and other toxins, known and unknown, things that you're not exposed to, like hormones that are in your drinking water, right? These things affect physiology. Previous injury or surgeries affecting tissues. How many of us have had a mundane surgery? Like just had a mole removed, or gone in and gotten a nodule removed or something like that in our lifetime. Okay? Well, we don't think about the fascia in this term. If somebody's like, well, they're just going to go in there and they're going to shave off that bone spur. No big deal, right? No big deal until you consider the fact that they've got to go through about 6 different layers of muscle and fascia to get there. You go and you cut through that. How does that now affect the mechanics of everything else going on? How are you going to fix that? Right? So you go in there to fix a problem, right, on the inside, and we don't realize we're creating a whole nother list of other problems. So therefore, surgery should be an absolutely last alternative, no matter where it is in the body. Going in there and cutting things away should be the last thing that we do, because there's so many considerations that we just don't understand yet. So in other words, all the basic foundations of health are naturally cofactors to proper function. You see, all of them work together. Now you understand why we deal so much with nutrition, why we teach exercise, why we want you to be functioning at your highest in every level, because it affects how well we're able to get an outcome with your spine as well. Make sense? Okay. So the chiropractic adjustment, obviously this is the starting point. This is a video of a very early video from 1924. If you guys don't recognize, this is the man himself. This is B.J. Palmer. Okay, this is the developer of chiropractic. And this is some slow motion footage of him adjusting. Amazing that they had slow motion back there, but how many of you guys would like to be adjusted like that? This one here is adjusting the dorsal, the middle dorsal. This is the mid part of the spine, and we're going to be covering this a little bit more in detail as we go forward. But watch the impact here. Pow. And then this next one is going to be him adjusting the lumbar spine. I love watching the recoil of this patient bouncing up off the table. Watch the hair on this too. Unreal, huh? So obviously, and guys, honestly, this man was brilliant. I mean, this is the guy that developed everything that you guys are here to learn about, and the results that you're getting today are because of the passion of this guy. I mean, there's one guy, well, maybe the second guy in history I'd like to meet, right? This would be him. Okay, this would be the guy. Unreal what this guy accomplished in his lifetime and how much he's changed the course of history. So, you got to give him applause. But I think I am safe to say that he would be incredibly proud of what we've learned and how far we've advanced and what we're able to do today, because this is the stuff he was working to figure out during his lifetime, right? So he'd be very proud of what's happening even right now. So, why the adjustment is critical in both curative and preventive practice. And what I mean by that, curative means fixing your problems, but preventive means fixing problems you don't yet have. Okay? So it's got effects on both areas. The primary purpose of the adjustment is restoring the brain-to-body connection, as the central nervous system is the body's best physician. There is no doubt about it. God needs no help, just no interference. Okay, the power that made the body heals the body. All these things that have been around chiropractic for 100 years, they stand absolutely true, that you are the doctor. You're the doctor. I don't fix anything. All I do is remove interference. That's all a doctor can do. Well, there's another thing a doctor can do. He can create interference, right? If you give the body things that interfere with function, or you do things to the body that interfere with function, you might as well have left it alone in the first place. So But the body's best physician is your own central nervous system. It is taking care of everything that you don't see at every given moment, and it does it so well. It knows so much of what it's doing that it even puts you to sleep for 8 hours a night so that it can work without you interfering. That's amazing. So the first one is a reduction of direct nerve impingement, the old bone on nerve, and that's been around forever. That was the original idea of chiropractic on why it works. Basically, we understood at the beginning times it worked. Why? Because patients got well. They just didn't have the explanation on why it worked so well. So they figured, well, it was simple. We're moving the bones, and the nerve system controls everything, so the bone must have been on the nerve. So that does happen in some cases, but it's not just restricted to that. We know now that reduction of soft tissue compression causing irritation or ischemia is a factor. Okay, let me break that down. When you have torque in the spine, or when you have injury to the spine, you have inflammation, or you have all kinds of distortion problems in the spine, the soft tissue around the nerves, around the spine, can actually compress on those nerves, causing mechanical irritation, or it can compress the arteries and the capillaries that feed the nerve its oxygen and nutrients, and so that causes ischemia, or lack of blood flow to that nerve. So these things are factors. Then there's also reduction of cord obstruction, torsion, elongation, or anything else that can affect the spinal cord. So when you have distortion in the spine, it negatively impacts the way that your spinal cord can function and do its job effectively. Make sense? Okay, so all these things, and I'm sure there's more to it than this. These are just the things that now we know are occurring in a distorted spine. Principles of chiropractic adjusting. This is the part that most chiropractors would rather I not cover. Okay, but these are the things that I have to cover, because you guys might end up in another office someday if you move, or I go somewhere, which I don't plan on doing. So through repeated testing, 2 chiropractors are terrible at coming to the same conclusion based on palpation alone of the same patient. This has been done over and over again. So basically the idea is this. We lay you down, and we have 2 or 3 or 10 chiropractors line up and assess the same exact patient. And what do we find? A completely different set of ideas of where the subluxations are, what direction they're going in, and everything else. So what does that tell you about how well we can feel what's going on underneath 6 layers of muscle and skin and layers of fat and clothes and everything else? Not very accurate. So what's a better way of doing it? Look at an x-ray, right? An x-ray is a simple, time-tested, safe, and proven means of assessment with a very good degree of consistency. Okay? So what you don't see will hurt you when it comes to results. So should you be getting adjusted unless you have x-rays to show you what's going on? Not really. Unless there's a certain specific set of exclusions, which might be pregnancy, right? That might be one, because you can't get x-rays while you're pregnant. Should you still get adjusted? Should you still do the best that you can? Yes. But are we going to fix your spine if we don't know what it looks like? No. So what's the purpose of adjusting while you're pregnant? To maximize function until the baby is born and you can get x-rays and actually start fixing the underlying problem. Make sense? Okay, infants. That would be another one. Small children. I don't always get x-rays on babies. I usually don't unless there's a major reason to. Why? Because they shouldn't have long-term distortion in the spine. You keep the tree growing straight, right, and it will grow straight. So, my kids, they did get adjusted. They started getting adjusted the day they were born, but they didn't get x-rays until they were almost 2 years old. And what did we find when we got their first x-rays? They were good, right? You'd expect that. They've been getting adjusted, being straight all the way growing up, okay? Even though a patient clears, you guys have heard that, you're clear, like we've cleared out the, the interference that we've found, the obstructions that we've found, the subluxations. We've done everything that we can, you seem to be clear there in that moment, nothing else is moving. That does not mean that your x-rays have changed, right? If we take your spine, you've got a 20-degree scoliosis, we adjust you, everything is cleared out, you can't adjust anymore. Does that mean that we can go and look at an x-ray now and you're back at straight? No way. Okay, so even though you're clear, your nervous system is clear for the moment, it doesn't mean that your x-rays have really changed, let alone now consistent with textbook normal. Therefore, what? This is a part of care. You clear out the nerve system. You clear out the nerve system. You clear out the nerve system. But along the way, you're doing things to change the spine. Okay, makes sense? So, consideration of good form is just as important in adjusting as it is in exercise. What do we talk about good form? Good posture. Okay? Adjusting the thoracic spine face down. I'm sorry, BJ, right? But I got to call you out on this one, buddy. Adjusting the patient face down is not good in most cases. You know how he was on top of him and smash, right through the mid-thoracics? That happens all the time, even still today, but it's not good for the thoracic spine. Why? Because you're supposed to have a curve like this. And so if you consistently smash that curve down, what happens? You straighten out that curve. What if the patient already had a straightened out curve in through there? You straighten it out even more. I've seen patients that their thoracic spine is inverted. It's like, where did your heart and your lungs go? So when you straighten out the thoracic curve, what other curve does it straighten out? All the other ones, because the spine is one unit. So you end up with a straight neck also. So you shouldn't do it that way. That's why, what do? We ball you up like this because it extends that thoracic spine into a curve and makes it easier to adjust it without injuring the thoracic spine, without lowering that curvature. Make sense? Okay? So you really should not be doing that. Occasionally you might need to just to get something to move, like a rib or something like that. But as a general rule, if you continue to do that long term, you will damage the spine in most cases. And we've seen this happen, unfortunately, more times than we care to. All tissues have limits of anatomical integrity. What that means is that you can break a barrier point where the tissues are injured, right? If I come over to you and I have you bend my arm backwards, I'm going to say ouch, 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 right? But at some point, what's going to happen? You break the limit of anatomical integrity and my arm snaps, okay? So all tissues have that limit, okay? You can pull your ear hard enough and eventually it's going to rip off, right? So while chiropractic has a very long history, over 100 years of safety and effectiveness, less is often more and the pop isn't always necessary. Okay, I've had patients that have scoliosis that I've adjusted for almost a year without getting a single audible pop. Yet what do we see on their x-rays happening? Reduction. You see the scoliosis cutting down. Well, how does that happen? I thought the pop was what was doing it. No. All you're doing is you're introducing energy into a system. Okay? The spine is a functional motor system. So it's kind of like, think about you're trying to get a car out of a puddle of mud. Okay? The car's putting out tons of energy, spinning its tires, spinning its tires, spinning its tires, and it's not getting anywhere. And you walk in there with your mud boots and you stand in there, you don't make any noise at all, but what do? You put a little bit of energy into the system and the car goes pulling out. That's the same thing. It doesn't always require that pop for it to happen. You're just putting energy into the system to change it. This is just basic principles of physics. So pain is the body's warning system and should be considered an ally when adjusting. If it hurts, if it feels like you just had a 400-pound gorilla drop on you and you can't breathe for 5 minutes because it knocked the wind out of you and you have pain, I think it's safe to say that was too much. Right? I've had that happen to me. I've had a lot of adjustments in my lifetime. So these things, if anything, they're things that I've learned and I'm passing on to you guys. Okay? More principles. The spine is not separated into units. Despite the fact that we call it the cervical spine, the thoracic spine, the lumbar spine, the sacrum, the skull and occiput, we break it into these categories. It is one system. It's one system. It all works together. One part, the bottom of the spine, does not work independently from the top of the spine. In fact, the bottom of your foot does not work independently from the top of your head. It all works as one unit together. So adjusting just one area because that's where it hurts and also because that's all you're being paid to adjust, it's just not acceptable. But unfortunately, it is common. So adjusting should not be done just for reduction of pain. What should it be doing? Fixing the patient's problem. And we as chiropractors like to say that we go after the cause of the problem. So therefore, by our own philosophy, we can't just adjust you where it hurts. Does that make sense? Okay. If the adjustment alone, this is where we get into therapies. If the adjustment alone was enough to fix an x-ray, I would never again get into a car for fear of an auto accident, right? Unlike an orthodontist fixing free hanging teeth, the spine is possibly the most difficult structure in the body to change, yet we're doing it successfully, right? I mean, if that impact was enough to permanently deform your spine, I wouldn't want to get in a car. I mean, if even a 5-mile-an-hour bumper, you just kind of bump into something, if your head just, you just pop over and you're stuck in that new position, keep me out of the car, man. I mean, you guys just, act like you're going to punch me. I'm going to flinch. I'm going to be moving out of the way because, you should be glad that your spine is elastic. It resists injury because of that elasticity. Okay, so that's what we've got to cover next. Now, there are some cool things as far as the future of spinal assessment that's going to make our jobs a lot easier as time goes on. And these are new technologies that are not real popular yet, but they will be. Okay, these are the next generation of things. A while back, I said, what we really need to happen in chiropractic is we need to be able to make 3D models of the spine. We need to be able to, like in the movies, in the science fiction movies, they do a scan and they can see everything as a 3D model above the person's body. Instead of looking at, okay, this is your side view and then this is your front view, and we've got to somehow in our mind figure out which way is front and back and left and right, and try to figure out what's going on there. It took me the longest time. I used to look at my x-rays the opposite way, and so I'm sitting there looking at the screen and I'm trying to figure out how to adjust the patient, and then I realized, dummy, flip them over and you're looking at them straight face down. Simple things like that, but still it's so archaic trying to figure out a three-dimensional object by looking at two-dimensional pictures. Well, yeah, so I mean, we've got to move into the next level, and things like this are going to happen. So I came across this EOS technology, where they're now able to take two planar X-rays. It's a biplanar X-ray, and it works on a scanner. So it goes down and it takes a thin slice as it scans down from two angles down your body, front and side at the same time, and gives you a 3D model of the spine. Pretty cool. Unfortunately, it's ridiculously expensive. So it is. It's not even feasible for hospitals and sorts. It's like over $1 million for this machine. So that's kind of out of the question, at least for the time being. Although I did email them and say, hey, I would be glad to test this on a chiropractic setting. If you guys really need a field trial, just call me up. I'd be glad to put one into my office for you. Then there is another technology called digital motion X-ray. And this is basically a fluoroscopy, but it's taken into the digital age. So fluoroscopy has been around for a long time, where you can take a full video, you can watch things moving, but it used to be you were just blasted with radiation to be able to do it. I mean, think about holding down an X-ray button and you're standing there, moving around, Well, that's the way it used to work, but now with the digital fluoroscopy systems, they use very, very low X-ray to be able to get video pictures. And so with this system, you're able to take up to 90 second, a minute and a half of video, and use only the same X-ray that you would get in a standard 7 or 8 view series. Unreal. It actually takes about 2,700 pictures in that time frame and splices them all together so that you see it as a full motion video, the same way that they make movies. Okay, so the cool part is, and you guys are the first to know this, and it's not official yet, but possibly within the next month or two, we will actually be installing one of these in the office. We'll be the third in Alabama in the entire state. So pretty excited about that. This is gonna, I mean, a tool like that takes your research to an entirely different level, because now, think about it this way. This is a way it was explained to me. Imagine trying to, as a coach, analyze what happened in a football game by looking at Sports Illustrated. Okay? But now, go back and replay the tapes. You see the difference? That's the difference of looking at pictures versus looking at video. You can tell a whole lot more by looking at the video. So this would take our research to an entirely different level. Okay, ligament science. This is the therapy supporting the adjusted spine to achieve structural change. These are a few big words, okay, so we're going to go through what these mean. Hysteresis is the lengthening of a ligament as it is warmed up. So think about this like a rubber band, okay? If you take a rubber band and you stretch it out and then let go of it, you put energy into that system. Believe it or not, but that just stretching that rubber band one time and releasing it does increase the energy of that rubber band. And it actually increases the temperature of that rubber band, okay? And it actually lengthens the rubber band from where it was before you stretched it. That's called hysteresis, okay? It rebounds back to its normal position for the most part, you know, as far as you would be able to tell. It goes back to the same position, but it really didn't, okay? That's hysteresis. The same thing happens with ligaments, okay? The next one is creep. We're not talking about Minecraft here, right? So creep is the lengthening of a ligament under a constant force. Okay, so what that means, it's essentially like this. If you put a rope around a branch of a tree and you pull down on the rope and then you let go of it, the tree branch bows right back up to where it was, right? That would be hysteresis. But creep is when you take the rope, you pull it down, you tie it to the back of a bumper, and you walk away for 3 or 4 months. And then you go back and you cut the rope, what happens? The tree branch pretty much stays where it was. You know, it might bounce back a little bit, but for the most part, it has completely changed its position. Okay, that's what creep is. Viscoelasticity is the ability to return to shape after force is removed. So viscoelasticity really goes hand in hand with hysteresis. Okay, that's what explains how that works. Viscoplasticity is the permanent change of a tissue even after removal of force. That's what creep is. Okay, so the conclusion here is that adjusting a cold spine, meaning you just came in, you walked in the door, you got out of your car, you walk in, you lay down on the table, and you just get adjusted. That's all you do. You know, whether you're in an office that just doesn't do any warm-ups, or you cheated on your therapies and you came in and you were like, and you just jump up on the table because you don't have time, right? Either way, your spine cannot change. You cannot change an elastic spine unless enough force is used to bypass the elastic threshold, which is called injury, right? I mean, I can change it even though you're still in the elastic state. I just got to push so hard that we rip something. Do you want that? No. So in other words, you can't create a permanent change in that scenario. So in order to change a spine, you have to warm it up enough to cause the viscoelasticity to move into a viscoplastic state, so that now you have hysteresis occurring, moving from, like I said, elasticity to plasticity. Then and only then can creep be safely achieved over time. Does that make sense? That's a lot of words. You see why I gave you all the vocabulary up front? Okay, you guys are learning what chiropractors learn now. Okay, this is the intense stuff. Okay, so ligament therapies. There's static and there's active traction. There's two different types of traction. You guys have seen the static tractions. Those are the ones where you fill the water bucket and you hang it up over the door, and you're tractioned up with the water bucket hanging from your head. And you just sit there for 20, 30 minutes, and then you let go of the bucket and you get out of it, right? So what it did is it stretched out the tissues and sustained it in that stretch. So it's working basically like creep. It's trying to initiate creep in the spine. Unfortunately, it doesn't get a lot of motion in the tissues. Another one would be the inversion tables, right? You guys see the tables that you get locked in and then you flip upside down? People ask me about those probably at least once a month. Should I get one of those? I'm like, well, considering you already have a traction unit, you already have a wobble chair, If you find one for $10 at a flea market, go ahead and buy it. But I wouldn't spend a lot more than that for it, because you already have the tools to do it more effectively. Okay? So those things are static traction. They don't really get a lot of exercise in the tissues. They don't really encourage nutrients and water and oxygen to move through the tissues. In order to do that, you have to pump the tissues. Okay? That's why we use the cervical traction units. That's why we use the wobble chairs, the wobble cushions. Anything that allows a up and down motion in those, it does the same thing. It tractions, but it relaxes. Tractions, relaxes. And so it's drawing water and nutrients into those tissues like a vacuum pump. Okay? So another one that works really well is vibration therapy. The reason why is because it's doing the same thing, the up and down motion, but it's doing it on a microscopic level. It's doing it so fast that it just feels to you like vibration, but you understand it's really up and down, up and down, up and down. Okay? But you have to have the adequate amplitude and the correct frequency for it to occur. Okay? So the big purpose there in telling you that, beware cheap imitations like these weight loss machines, because whole body vibration can also have negative effects. Okay? For example, you go into an office and instead of having $4,000 vibration plates that are meant for that purpose, they have $200 eBay specials that are shipped out of China, and they're for weight loss, and it just shake you all over the place. To somebody who doesn't know any better, it's the same thing, right? But it's not the same thing. You might lose a few pounds, but you're not actually going to cause a change in the structures. In fact, you might end up with some intestinal dysfunction or something else that was uncalled for. Okay, so combination therapy, when you apply these things together, this amplifies and multiplies the effects. That's why we combine the things like vibration with the traction, because you're not just doing one after another, after another, after another. When you put them together, it combines the effect. It actually multiplies it. So it becomes more effective than the two individually. All right? It's kind of like putting two oxens on a cart, right? Two oxens together can pull more than the individual oxens put together, just adding up what they can pull individually. You guys have heard that analogy? Yes? No? Okay. Did that even make sense, right? Okay, so spinal molding, pelvic blocking, heel lifts, all of these things, they basically do the same thing. They're not static, they're not active traction. These are more static movement of the ligaments. Okay, so the spinal molding, the pelvic blocking, heel lifts, when they put lifts in shoes, what they do is it's a sustained force. So what process does it cause? This is a test. Hysteresis or creep? Creep. Yes, very good. All right, we're getting there. So spinal molding is there to cause creep while you sleep, right? You guys can remember that one. That's the only time a creep while you sleep is a good thing. All right, muscle fascia science. The muscles are the motor units to move bones as levers one upon another. Okay, you get that? So the muscles move a bone. They move levers in accordance with each other. Weak motors not only inhibit proper motion, but often cannot maintain even proper positioning. Just basic posture. If you spend your day never exercising, you just sit on the couch, is it any surprise that you have bad posture? Because as your motors got weak, they are no longer able to hold the static position of the levers, called the bones, in your spine. They are no longer equipped to provide even the basic function of what they do, let alone advanced motor skills. So that's why movement and exercise is so critically important. There's two types of motion. There's passive motion and there's active motion in a muscle. A active motion would be if we were to arm wrestle. We put our arms up and we try to push each other down. A passive motion is if I let you win. Right? Because then you go and you push my arm down and I'm not contracting, yet my arm, the lever, is moving, right? So these are the difference in active and passive motions, and both of them apply when you're talking about fixing the spine. Fascia is, like I was talking about, has a very, very high tensile strength. It's 2,000 pounds per square inch is the estimation. However, when damaged or containing adhesions within it, it cannot provide proper function and must be gradually restored like ligaments. What I mean by this is if you've had surgery to, let's say, your lower back, and they cut through that fascial network, well, now you don't have that tension in there. So you have adhesions in it, things pull abnormally, so it's not going to work properly. At the same time, though, let's take a different example. When it just becomes adhesed through poor posture over time. Anybody ever seen somebody like this? You know, they're down like this all the time. Well, if you're stuck like this for years and years and years on end, the fascia inside actually constricts to this level. I had a patient one time, she was stuck in this position, and she ended up having to have surgery to peel her lungs off of her rib cage, off the inside of her rib cage. And when they did that, she was actually able to come up pretty well. Unfortunately, she didn't fare so well after that. But the point is when you change your posture over time, your fascia will actually reconfigure to that new position. How do you fix that quickly? You don't, right? You know, a lot of times we want the results really, really fast. Well, you've only got two ways to do really, really fast. Well, really, you've only got one way to do it really, really fast. It's called injury. The other way is what? Remodeling. And that takes time. It is time dependent. So some cases, they just take longer than others. If these processes have set in, degeneration is a big factor here. That's why degenerated spines always are more difficult to fix. Okay? The muscle and fascia therapies. Number one is the osteometric exercises. They provide targeted strengthening. So for example, you know, if you guys have a forward head posture, we have you push into your hand, right? Or push into a wall. Ideally would be you have your hands down, right? So it's a symmetrical exercise. But, you know, if it's more efficient for you to sit in the car and do it, then, you know, just push against your head for a minute. What that does is that provides targeted strengthening to the muscles that we want to interact with, okay? The next would be body weight system. The body weight system, it provides both an active and passive muscle activation to improve posture. Some of these work through active process, some of them work through passive process. It just depends on the weight. For example, the head weight is an active process. So you put the head weight on, it shifts the center of gravity anterior of your head because now you've got an extra 2 pounds out here. And so now you have to shift your head back to realign the center of gravity. So it's an active process. You would think you put it on and it's going to cause your head to flop, right? But it doesn't do that. You respond by pulling back. On the other hand, like a sacral weight, for whatever reason, that's a passive process. When you put, we call it the bunny tail, right? Any of you guys that have it, you put that weight on the back side. If your sacrum is too high, we're fixing cheerleader butt with that one. We got fun names for everything. So you put the weight on your back. So you put the bunny tail on your cheerleader butt, and it drops your butt down, right? So now you start having more of a flattened rear the way that it's supposed to, the way it's supposed to be. Okay, so it depends on the therapy as to which one does which, if it's active or passive, and we can utilize those tools in different ways. The limit is that the time factor is a downside. Okay, you can only wear the head weights and the body weights for so long. Because if you go over 20 to 30 minutes, then it starts to actually over-fatigue the tissues and you go into what? Injury. So you don't want to overdo it with the body weights. It's a lot of impact into the system. It's kind of like, you know, imagine if you were doing dumbbell curls. You know, it's good to a degree, but if you kept on doing them all day long, at some point you're going to injure those muscles. Same process goes with the body weighting system. So we have something now that makes up for that. It's a posture strap. It provides time-sustained activation of the postural muscles. So you put the postural strap on, and what it does is it gives you that gentle reminder to keep your shoulders back and your head back in that normal posture to retrain those muscles over time. So now you've got two different processes that do two different things, but they both work towards the same end result. And they work really, really well together. Then the last one is just basic fundamental exercise. You want to stick to balanced multi-joint exercise because it encourages symmetry, strength, and endurance. I have patients ask me all the time after they start getting adjusted, Is it okay to start exercising? Is it okay to start running or jogging? Absolutely, it's okay, because running and things like that, they're symmetrical exercises. They're only at their maximum efficiency when your body is working symmetrically. So nutrition support has been really helpful. It gives the body the building blocks to heal, but it's still time and bioavailable dependent. What I mean by that, with time, of course, it's got to have time to build up in your system. It's got to have time to flush things back into the tissues and rebuild stores that might be missing. And it's also bioavailable dependent, because if you just take, a cheap version that you found online, because it was a couple bucks, and and it's basically a lab created nutrient, it's not in its natural form, well, it's not going to absorb into your body, so it's going to take a lot longer to do anything that it needs to do. So you're still really limited on some of this stuff. Now, there are new technologies such as laser and infrared that do show promise, and prices will continue to come down. I mean, as these technologies continue to improve, I mean, how much does it really cost to make light, right? It's just a matter of creating the right diodes and having the right equipment, and it becoming popular. And once it becomes popular, there becomes more competition. And as competition comes in, now the race is on and things start being available to the public. One thing that I have come across, I said for the longest time, I've been looking at this for probably the last 2 or 3 years, just randomly looking for a flat, flexible laser system. Okay? They have lasers that basically, they've been around for a while, where the doctor has to stand there for 45 minutes going like this. I'm sorry guys, but I don't have time for that, right? So we've been looking for a flat, flexible one that we could use, for example, to lay on top of a traction unit while you're doing your traction. These things are adjunct therapies that just add to what you're already doing, okay? And just happened to come across one that was just designed. This laser wrap system, ironically, was designed for horse racing. Okay? They made a flexible laser system that actually wraps around the leg of a horse, and it delivers the same thing in time graduated segments. So it will turn on for 20 minutes, then turn off for 2 hours, then turn on for 20 minutes, and turn off for 2 hours, and it does it automatically. So they put it on the horse, they put the sleeve on, and let it run away. And 3 or 4 days later, they take it off, and the edema is gone. The horse's ligaments are healed up after the races, and getting tremendous results from it. And then what happens? Naturally, the trainers are like, well, dang, that worked really well for that. I wonder if that's going to work for my lower back, right? So they start sticking it on themselves, and they're like, whoa, this stuff is really working. So I just happened to stumble across this, and yes, we will probably be testing these very, very shortly. So as new technologies come available, we're going to try our best, with the access that we have, to stay on top of the cutting edge and making sure that these technologies are available and that they can be utilized, because we have the problems that need to be solved, but we need 2 things for that to occur. We need to have the research for that to occur, we need to have the access for that to occur, but we also have to have the resources for that to occur, right? So where do the resources come from? They come from patients, they come from people, they come from you guys referring people, they come from you helping other people, and hopefully, they would come from fairness, meaning that eventually insurance gets their act together and they start compensating chiropractors the way that they compensate any other doctor, which the recent legislation did say that they're supposed to do, and now there's a big fight over if that's even going to happen. So there has to be fairness in the system, and when that becomes available, when the field becomes level, guys, it's going to be a new day in healthcare. Because people are going to realize that prevention is the way to go. It was the way to go 130 years ago. It always has been. But it's just not being practiced because it's not profitable. But in the long run, it's the only thing that's actually sustainable. Profitable or not, it's the only thing that's sustainable. Okay? So we've got a lot of work to do. Last thing I do want to announce real quick, announcing company number 3. Innate Innovations
is actually live now. We've actually formed this company. It's not really new. We've done tax returns on it for the last 2 years. Just haven't done anything with it. But this is actually the company that is going to be producing the home care equipment and stuff that we need based on the different scenarios. So as we come up with something new that works, we'll actually be able to produce it. Because a problem that we've had, any of you guys that use, for example, the pendulum weight back there, the big box car, bumper car, tiki bar, whatever you want to call it, it's got plenty of names, port swing, we could go on all day long. It's been called numerous things. But if you guys use that here, you've seen you don't have one at home. Okay, should you have one at home? Absolutely. I mean, we put that thing on people that have a flat lower back, and we take a stress film of them, and it is unreal how well it works, putting that curve back in there. So anybody that needs it should have one at home. But see, we couldn't send one home with you. Why? Because in order to produce it, there's a liability that goes along with it. And that is not something that you want to tie together. So for many reasons, one of those being legal, we had to create a separate company to differentiate that liability. And so now that's up, that's ready to go. We're starting to produce, you guys have seen them walking around with posture straps on. That's the first item that's being produced by the company. And as we get moving here, we're working on the final design for the pendulum weight for the home use unit right now, so that we can start making those as well. And as time moves on, you know, you'll be able to do more and more stuff with that. So pretty cool. Neat logo too, huh? Yeah. Go save someone. You know, you guys have way more information now than even most chiropractors are putting into practice, sadly. So you guys are incredibly well equipped to go out there and really tell people how scientific chiropractic really is, that it's not 100 years ago anymore. Okay, so go save someone, find somebody that needs help, and do your part to push technology. I mean, push the future forward. I mean, that's a big thing. I hope you guys see now. You are literally driving the future forward. This is changing healthcare for everybody. Okay, awesome stuff. It's amazing to think. So, all right. Any other questions? Nope. Rock and roll. Okay.